Again, welcome. Up to now we have seen the skin, the superficial fascia and the deep fascia of the sole, which is forming the plantar aponeurosis and some intramuscular septum, the lateral and medial intramuscular septa. These septa will give some transverse septa. These septae will divide the muscles of the sole in 4 compartments: first, the second, third and fourth compartment of muscles. The foot, which is formed by the 7 tarsals, the 5 metatarsals and the 14 phalanges. These bones are arranged in a segmental manner to transmit the force which is generated by the gastrocnemius muscle, and this weight or the force generated by the gastrocnemius is transferred from the heel to the ball of the foot by this segmental and resilient and rigid arrangement of the bones and the muscles of the foot. So there are 20 muscles in the foot. 2 are in the dorsum, 4 are the intermediate muscles and 14 muscles are in the sole. These muscles are arranged in or architectured in a manner where the rigidity and the resiliency of the foot are maintained and the arches, the medial, the longitudinal and the transverse arches are maintained. So in this lecture I will start with the muscles of the sole of the foot. First of all, again I will talk about the bony framework or the bony anatomy of the foot. So again here the articulated bones of the foot. So this is the anterior and here it is the posterior part. This is the dorsum and this is the plantar surface of the foot. Here we can see the big heel bone, the calcaneus or the calcaneum, the ankle bone or the tarsal bone, talus bone and the tarsals are here. So here it is the navicular bone, the medial, the intermediate and the lateral cuneiform bones, and here we can see the big cuboid bone between the 5th metatarsal, 4th metatarsal and the cuboid bone forming a saddle joint, and the ball and socket joint formed between the calcaneus, the navicular and head of the talus, which is here. So again we can see the bony framework which is formed by the 7 tarsals. The tarsal elements are larger in the foot because it has to bear the weight. It has to propel or push off the weight of the body during walking. So the tarsal elements are larger than carpal elements, as we have seen in the hand. The first metatarsal is thick, strong and stout because it has to bear the 2 points of the weight which are formed by the 2 sesamoid bones in the tendon of the flexure hallucis brevis, which I will talk later in this lecture. So first of all I will talk about the muscles of the first layer of the sole or the plantar surface of the foot. So the plantar surface of the foot is having 4 layers or 4 compartments of the muscles which are arranged to support the arches of the foot, to support and to hold the bones together in the plantar as well as in the dorsal surface of the foot. So muscles of the sole of foot. There are 4 compartments or 4 layers of the muscles which are arranged in superficial to the deep layers. So first layer is having 4 muscles. First layer is having the 3 muscles. The abductor hallucis. This is the medial most muscle in the foot, forming the medial contour of the foot in this plantar surface. The second muscle is the muscle flexure of the 4 lateral toes, the flexure digitorum brevis. As the name, the muscle is flexure for the digits or toes, and brevis, it is the short or small muscle of the sole of the foot. The third muscle of the first compartment or first layer is the again abductor digiti minimi. Here also we can see the name of the muscle. It is abductor, bringing the part away from the midline, abductor. Digiti, the digit, and minimi, the small or little finger of the foot. So again there are 4 muscles, 3 muscles in the first compartment of the 4 compartments: the abductor hallucis, the flexure digitorum brevis, and the abductor digiti minimi. These all muscles are taking origin from the calcaneus and inserted on the first phalanx of the great toe and the fingers. So these all muscles are taking origin from this part of the calcaneus. The medial and the lateral tubercles of the calcaneus are the origin point for these all muscles. So again we can see the calcaneus. So here we can see the calcaneus, and this part of the calcaneus is giving proximal attachment. This part is giving the proximal attachment to the muscles of the first layer or the first compartment of the sole. So here we can see again the first muscle of the first layer is the abductor hallucis. The proximal attachment or the origin of the muscle is from the medial tubercle. This is the medial tubercle of the tuberosity of the calcaneus. So this is the medial tubercle, and the abductor hallucis is taking origin from this point. This is the point where the abductor hallucis is attached proximally. So the medial tubercle of calcaneus. Calcaneus is also known as heel bone, and it is a big bone, or I can say biggest bone among tarsals. The second is the medial intermuscular septum. The third attachment of the abductor hallucis is the flexure retinaculum. And the fourth proximal attachment is the plantar aponeurosis. So the muscle is attached by 4 points proximally by the medial tubercle of the calcaneus, the medial intermuscular septum, the adjoining part of the flexure retinaculum. Retinaculum means curtain. So curtain-like thickening of the deep fascia on the medial part of the foot is the flexure retinaculum, and the adjoining part of the plantar aponeurosis. Plantar aponeurosis is thickening and modification of the deep fascia of the plantar surface or the sole of the foot. So these are the 4 proximal attachments of the abductor hallucis. Here I will draw the this is the posterior part of the calcaneus, the lower part of the talus. Here we can see the navicular bone, and this part is occupied by the cuboid, the medial, the intermediate and the lateral cuneiform bones. This is the first, the second, the third, and the fourth and fifth metatarsals. The first or grade 2 is having only 2 phalanges, the proximal and the distal. Forming the ellipsoid joint with the metatarsal head, and the joint formed between the first or proximal and distal interphalanx is the hinge joint. So in the second, third, fourth, and the fifth, the little toe or little digit. So this is the bony framework of the foot, formed by 7 tarsals, 5 metatarsals and 14 phalanges. And this is the bigger one or biggest one. This is the bony framework of the sole of the foot, having calcaneus, the talus, the cuboid, the navicular boat-shaped bone, the medial, intermediate and lateral cuneiform bones, the big and lateral cuboid bone, the first, second, third, fourth and fifth metatarsals, the proximal and distal phalanx of the great toe, the proximal, the middle and distal phalanges of the first, second, third and fourth lateral toes. So this is the bony framework of the sole of the foot. The abductor hallucis, the medial most muscle of the foot, is taking origin from the medial tubercle of the calcaneus. So this is the medial tubercle. Muscle is attached from here, forming the fleshy part, and the distally it is having the tendinous part. Some fibers are taking origin from the flexure retinaculum, which is here. Some fibers are taking origin from the medial intermuscular septum, which can be seen here during dissection, and some are taking origin from the plantar aponeurosis, which is attached on the part of the calcaneus here. So this is the calcaneus. This is the medial tubercle of the calcaneus. This is the site or the location of the flexure retinaculum. This is the attachment for the plantar aponeurosis, and this is the site for or location of the medial intermuscular septum. So the fibers of the abductor hallucis, again from the medial tubercle, from the flexure retinaculum. The fibers of the retinaculum can be seen here. The fibers of the plantar aponeurosis can be seen here. This muscle is deeper to the plantar aponeurosis, and this is the location for the medial intermuscular septum. The muscle runs forward, and the fleshy part, initial fleshy part of the muscle, is converted into the tendinous part, the distal part, which is attached on the medial surface of the proximal part of the proximal phalanx of the great toe. Listen again. The fleshy fibers are forming the tendinous part, the rope-like part, which is inserted on the medial surface of the base of the first proximal phalanx, along with the medial insertion of the flexure hallucis brevis. So this part or this muscle is accompanied by the flexure hallucis brevis, the medial part. So this is the first muscle of the first layer of the sole of the foot. This muscle, as the name indicates, is the abductor of the great toe. But in shoe wearing foot, this movement is lost and regained in barefooted. So this is abductor, but movement is lost during the shoe wearing and it is regained in barefooted. So as the name indicates, this is the abductor of the great toe. The second muscle, this muscle is supplied by the medial plantar nerve, which is a branch of the tibial nerve. The fibers are taking origin from the ventral division or anterior division of the ventral primary rami of S2 and S3. So it is supplied by the abductor and supplied by the medial plantar nerve, which is a branch of the tibial nerve, and fibers are coming from the anterior division of the anterior or primary rami of the S2 and S3 in tibial nerve, in sciatic nerve. So the other muscle of the region is the flexure digitorum brevis. This muscle is also covering the trunks of the vessels and the nerve. This muscle is also covering the origin of the trunk of the nerves and vessels, and the main trunks of the arteries, veins and nerves are between the first layer and second layer of muscles, and the deeper branches of the vessels and nerves are between the third and fourth layers of the muscles of the foot or the sole. So second muscle, which is deeper to the, this is the abductor hallucis. The second muscle is deeper, so fibers are coming from the deeper part, and this muscle is also deeper to the plantar aponeurosis. The muscle is taking origin from the medial tubercle, the adjoining part of the flexure retinaculum, the adjoining medial and lateral intermuscular septum, and the plantar aponeurosis. Beneath that the muscle lies. So these are the fibers of the flexure digitorum brevis. So this is the fleshy part, and the muscle are dividing in 4 tendinous slips for each lateral 4 toes or 4 digits. So the origin of the flexure digitorum brevis is from the medial tubercle of the calcaneus, the flexure retinaculum, the plantar aponeurosis, and the lateral and medial intermuscular septa. Lateral intermuscular septa. So again, the origin of the muscle is from the, this is the origin, the medial tubercle of the calcaneus, the flexure retinaculum, the plantar aponeurosis, and the adjoining part of the medial and lateral intermuscular septa. So this is the origin of the flexure digitorum brevis muscle, and as the name indicates, it is flexure of digits, digit number 2 to 5. So again, these are the 4 points of origin of the flexure digitorum brevis muscle. Now these are the tendons of the muscle. We can see the tendons of the muscles. Tendon number 1, 2, 3 and 4. Each tendon is this is the one tendon of the flexure digitorum brevis muscle, will divide in a lateral and medial slips. So each tendon will divide in the medial and the lateral slip, and form a gap between the medial and the lateral slip. The tendons will reunite opposite to the first phalanx. So tendon will divide in medial and lateral laminae or slips. These laminae or the slips will reunite. There is bifurcation first, then reunion of the two tendons, and there is some crossing of fiber. Before bifurcation, there is crossing of some fiber. So this is the tendon, one tendon. There are 4 tendons in the flexure digitorum brevis. This is divided in medial and the lateral laminae or the slips. They will reunite, and some fibers from the medial to lateral and lateral to medial will cross to the opposite side, and these slips will be inserted in the medial and the lateral side of the middle phalanx of the respective toe or the digit. And this gap, which is formed by bifurcation of the two, is this gap which is formed between two will lodge the tendon of the flexure digitorum longus, which is a muscle of back of thigh, the intermediate compartment of thigh, and here it will make the muscle of the second layer of the sole. So this gap is occupied by the tendon of the flexure digitorum longus. This type of insertion we have seen already in the palm, and it mimics with the insertion of the flexure digitorum superficialis of the